for some answers, let's turn to Dr. Alok Patel. He's a pediatric specialist and a medical journalist and joins us from San Francisco. Dr. Patel, what have we learned in the week since we first learned about Omicron? I think the two major issues or concerns, if you will, are whether this is more contagious and if existing vaccines can still be effective and can still protect us.
Well, Asieh, I think one of the first things we learned is that if we continue to let the virus spread and replicate, it's going to mutate. We could potentially create a deadly variant or a more contagious variant like Omicron, which we're seeing right now, and how important genomic surveillance really is, which is why I hope the world is giving applause to the South African scientists who first flagged this. Now, to go to what you're saying, there's enough speculation out there and kind of that anecdotal data based on how quickly cases are rising to suggest that this variant is in fact more contagious. But an important couple things to pay attention to is we don't yet have the definitive evidence to say it is more virulent or going to cause more severe disease, and also to say that it's going to be able to evade our antibodies or our vaccines. So yes, as you mentioned earlier, there's a lot more mutations on the spike protein, but it may not be enough to say like, hey, our vaccines are not going to work. The vaccines still absolutely are working really well. And in fact, the health ministry of Israel, he went out and said, hey, boosted patients are completely protected against Omicron. So we'll want to see more data on that as well.
It seems people who are vaccinated, even in one case that I know of here in the United States, the person did have a booster. They are getting infected, but it appears the symptoms are mild or maybe in some cases moderate. Is that perhaps a little bit of good news there?
Asieh, I think it is good news, and I don't think much has changed between what we're seeing right now with these cases with Omicron versus those cases we saw with Delta, when people who were vaccinated were actually still testing positive for SARS-CoV-2, but then we're going on to either develop no symptoms or mild symptoms. Now, a couple things to note is that we haven't seen cases where somebody who tested positive in the United States then passed it on to people around them, including the case in San Francisco, where none of the contacts of this person who flew back from South Africa tested positive. That's really positive news, because it's telling us that, hey, it might be more contagious, but it's possible that these people were vaccinated and taking the right precautions, and they all were protected against it. Remember, this is the same virus, and there's no mutation that's going to keep this virus, able to infect people with things like masks and ventilation. So all those still apply.
Let me go on and move on to South Africa. Omicron appears to be driving a big surge there, Dr. Patel. Again, most symptoms there also appear to be mild at this point. And we should add, South Africa's vaccination rate is less than 25%. What does that tell us?
That tells us that there has been a global failure in terms of vaccine equity. And I could not stress that enough. This is a global pandemic, and we have not been treating it that way for a year and a half. And this is the effect, is what has happened in South Africa. Now, I'll back up a little bit. And last week when these cases were reported, it was hard to kind of differentiate if this was a big new variant that was outcompeting Delta, or if it was a super spreader event, because we have seen reports now that a lot of these people were young people. And so, it's possible that, hey, they were all gathered together and that's how the spread happened. And maybe, and this is not the case we want to say, but maybe it's possible it's mild symptoms because these people have no underlying medical conditions. So anyone out there who says, hey, this is no big deal, it's mild, let it spread, we don't have enough evidence to say that, because there still could be a bad effect on those in the elderly population with underlying medical conditions or unvaccinated children.
I don't know about you, but I'm getting this sense of deja vu. We're talking about restrictions again, travel measures. Are we going to see lockdowns like we did once again here in the United States, like we saw in the beginning of the pandemic?
I don't think so. And there's nothing to indicate yet that that's the direction we're going to go with when it comes to lockdowns, because we have to pay attention to the fact that we are in a completely different place, not only in terms of vaccinations, but also in terms of our understanding of how to actually treat cases of COVID-19. And hopefully there's a massive increase in the amount of tests that are available for people. A year and a half ago, there were long lines to try to go and get a test, and we definitely didn't have over-the-counter antigen tests. So that makes a really big difference. And I'm hoping moving forward, we use those to test, isolate, contact trace, and do all that. But honestly, an important thing to know is that there could be changes in terms of travel restrictions. That's something that people need to take into account this holiday season.
All right, we'll have to leave it there. As always, appreciated, Dr. Alok Patel.